The March 1st deadline for the Liberal government to table its pharmacare legislation is fast approaching. And NDP leader Jagmeet Singh says his party will end its supply and confidence agreement with the Liberals if the pharmacare deadline is not met.
We've seen from the Liberals that their number one concern is bills passing in the House, and we've said that they cannot expect that to happen anymore. If they break the agreement, let's be really clear, it's the Liberals breaking the agreement. They're breaking their promise. Where the consequences of them breaking their promises, then the agreement is ended. So it would be the Liberals breaking the agreement.
This is nearly 1 in 4 Canadians are struggling to pay for prescription medication and are skipping pills, according to recent polling. Heather Evans knows this struggle all too well. The Calgary gym manager is on various medications for heart disease, diabetes, and from a previous diagnosis of bladder cancer. She says she's seen firsthand the need for affordable national pharmacare. Heather Evans joins us now. Heather, it's nice to meet you. Thanks for coming on the show.
Nice to be here. Thank you.
I was told it was rude to ask people about their medical conditions, but this is the whole point. You're here, right? You've been on several medications since suffering 2 heart attacks. How many pills and what other treatments are you taking just each and every day just to survive right now?
I take 23 pills, all different types, and 2 needles. I take a needle for a statin, which is called Repatha, and I take diabetic needles. So there's a lot. It's a lot. My bills for my medication after three months worth is over $5,000. No word of a lie.
$5,000? $5,000 every 3 months? Like, is that with benefits or
every 3 months?
With benefits or without benefits, Heather? Like, how does that cost break down?
I do have benefits. I'm blessed to work for Good Life Fitness, a phenomenal company that they have wonderful healthcare plan and benefit plans. So I'm lucky, but I don't forget where I came from and back, before I worked at Good Life. I started at Good Life in 2010. My first 2 heart attacks was 2004. So for that time span, it was rob Peter to pay Paul, so to speak, and it was just terrible. And no parent should have to make decisions between choosing to buy healthy food for your son and yourself, especially with a heart condition. You've got to eat healthy, or skipping. I would skip meals just to be able to afford, and I would buy things like macaroni and cheese, things that I shouldn't have, things that were cheaper. And yeah, it's not a fun situation, and nobody should be in that position to make those decisions. I had a phenomenal family doctor that if it wasn't for him during that 6 years, I would go to him and he would give me medication samples. There were times when I would go that, unfortunately there was lots of other people on samples as well, and he wouldn't have any. So I would be just literally panicking and not being able to sleep at night because I didn't know if I'd wake up in the morning. Without the medications, my quality of life would go down. So it was just a vicious cycle, and nobody should be in those situations.
Okay, there's a lot there, but during this, so you had this heart attack in 2006, your first one, right?
2.
And you had no benefits at the time? You had no job at the time? What was your financial situation?
No, I was raising my son. I was separated from my husband, and he would send a little bit money home, but no, I had no, because my son was only 5 years old when I had my first 2 heart attacks. Since then I've had 6 or 7 heart attacks, open heart surgery, all kinds of medical issues since the open heart surgery. But prior to that, even just the heart medicine, I was on Nexium, I was on a statin. Some of these drugs, 2 drugs alone were $400 a month. The Nexium and the statin, it's $180 each. Who can afford that when you're not working and you're a stay-at-home mom? And yeah, it's not okay. Not okay.
Yeah, and when you add all of that up, I mean, that's a financial burden you couldn't relying on medical samples from the doctor who has a drug rep probably giving them to them, and they give you what's available. So you have benefits now because you're working at Good Life.
Yes, absolutely.
So, literally, your life depends on your job.
And my life depends on the medication as well. And that's the point I want to drive across here is people don't ask to have chronic illnesses. We don't ask for it. And we're all doing the best we can in this world. We don't want to not be able to afford our medication. And, I'm somebody who absolutely a prideful person, and it was hard for me to go to my doctor's office and say, hey, I've got these prescriptions, can't afford them, can you help me out? That it took a lot to do that, and some people just can't do that. So there's a lot of people a lot of Canadians that are suffering that, they're ashamed, and they shouldn't be. They have no right to be. They didn't ask for these health issues to come upon them, and we just need to do better. There's the pharmacare. I'll just say this: I think that people are making money off of medications when people are dying because they can't afford them and they're not getting them properly. I believe that hospitals and clinics are getting clogged up with people that are going there unnecessarily because they can't afford medication. So their illnesses and their chronic illnesses are declining somewhat because they're not on a regular basis. Medication is something that needs to be taken on time, daily. There's rules and regulations to these medications. And if you're not following that, your quality of life goes down. And I just don't think that's fair that that's happening to people because they can't afford it. It needs to be either free or the price lowered to the point where everybody can afford it.
So for years, you had to choose between medicine and basics and looking after your son. And then the Good Life job came along and suddenly you got benefits. I mean, how has that changed your life?
I get tears in my eyes because this company's phenomenal for that. And there's not a lot. There's a lot of companies that can do it and a lot of companies that can't, but it's not nobody's fault. It's just the way it is. Good Life fitness industry, they care very much about people and their health, so they obviously make the benefits top notch, right? And I'm blessed and wake up every day, throw a kiss to the sky for Good Life and my life and Heart and Stroke, and and even doing this interview, it means a lot to me because I just want to help people. I want to make that difference. Somebody somewhere has to start making a difference and making better decisions on this because people's lives matter. And I want to say to the people that make these decisions that I want you to close your eyes for a minute and imagine the most important person in your life who you love the most in the world. And imagine they had a chronic illness and imagine that they can't afford that medication. Think about that for a minute. What would you do? You'd move mountains. So I'm asking people that make these decisions about the pricing of Medicare and medications, change it, make it affordable, make it free, do whatever it takes to make it so that people everywhere across Canada can afford medication that they need to save their life.
Well, Heather, just as a final point, this is the conversation going on right now between Justin Trudeau and his Liberals and Jagmeet Singh and his New Democrats on how to make progress on pharmacare. They disagree on how far to go and what way to do it. What's your message to them as they try to figure out a path forward on this?
Just like I just said, make the change. There's enough money in this world for everybody, and it shouldn't be a financial gain. Medication shouldn't be a financial gain for other people. It needs to be a savior to people that need it, the medication. They need to lower the cost, make it free. I mean, I'm not 100% sure on what needs to be done, but I know that the price of medication is ridiculous, and it shouldn't be that way. And just think about your loved ones. Look at your children, your aunts, your uncles, your fathers, your brothers. Look at them in the eye and think, what if it happened to them? What would you do, and what would you want? And that's all I'm asking.
Heather Evans, thank you for sharing your story and your message with us today. We appreciate it.
Thank you so much. Take care.